Good afternoon, and today we're going to do a modified cranial nerve exam for all of you. So, as you all know, there's 12 different pairs of cranial nerves. The first cranial nerve is the olfactory nerve, as Agnes and Gloria will demonstrate.
Gloria, can you identify the smell?
Yes, it's perfume.
Very good. So things seem to be working properly. So we can move on to cranial nerve 2, which is the optic nerve.
And to check this, I'm going to ask Marie when this pen light comes into her field of vision. No? And everything seems to be working correctly.
So now we can move on to the next test, which is going to test cranial nerve 3, 4, and 6. This tests the ocular motor, the trochlear, as well as the abducens nerve.
And to check this, I'm going to check it with her pen light to see if her pupil dilates, which it does. And then I'm going to see if her eye moves laterally, which it does. Thank you, Marie.
So the next cranial nerve is cranial nerve 5, which is the trigeminal nerve. This one actually has 3 different divisions to it: the ophthalmic division, maxillary division, as well as mandibular division.
And to check the ophthalmic division, I'm going to see when she blinks her eye, and that's working correctly. And to check her mandibular division, I'm going to see if she can feel my finger. Can you feel my finger?
Yes, I can feel it, yes.
And to check her mandibular, I'm going to ask her to move her jaw. Can you please move your jaw for us? Thank you.
So now we can move on to the next cranial nerve, which is cranial nerve 7, the facial nerve. This one actually has 5 different branches to it. There's the temporal, zygomatic, buccal, mandibular, as well as cervical division.
And to check this, I'm going to ask Marie to taste this and identify what it is that she's tasting.
Sugar.
Okay? And then I'm going to check her face first symmetry. Can you please blow out your cheeks like this? And then I'm going to ask you to smile. Can you smile for us? Everything is symmetrical.
So everything is working properly so far. So the next cranial nerve is cranial nerve 8, which is the vestibulocochlear, as they will demonstrate once again.
Gloria, what did I say?
You said, can you hear me now?
Very good. So now, the cranial nerve 9 and 10 can be tested in the exact same way. The cranial nerve 9 is the glossopharyngeal nerve, and the cranial nerve 10 is the vagus nerve.
And to check this, I'm going to check her gag reflex by putting this in her mouth. And everything seems to be intact. And then I'm going to ask her to speak, and she's going to say hello to us, and to cough.
Hello?
So everything seems to be intact.
So the next cranial nerve is cranial nerve 11, which is the accessory nerve.
And to check this one, I'm going to ask Marie to please rotate your head. Can you rotate your head for us? Good. And now I'm going to ask you to shrug your shoulders. Can you shrug your shoulders? And everything seems to be working correctly.
So the last and final cranial nerve is cranial nerve 12, which is the hypoglossal nerve.
And to check this, I'm going to ask Agnes to please protrude your tongue and retract your tongue. So everything seems to be working correctly.
And this concludes our modified cranial nerve exam. Thank you for joining us.